Hi, today we will be discussing the Marburg virus. It's a hemorrhagic fever very similar to the Ebola virus that has been in the news for the last few years. The Marburg virus is an acute hemorrhagic virus that causes severe illness, and if not treated, it will cause death. It normally occurs in humans and primates. A little bit of history from the Marburg is that it occurred back in 1967 when German scientists had imported green monkeys from Uganda. And these monkeys, of course, they were deceased, and the scientists were in the lab and they were doing examinations on the cadaver tissues, unbeknownst to them that these tissues were infected with the Marburg virus. Currently, the Marburg virus occurs in several different stages, and we will talk about those. In 2012, in Uganda, there were 15 cases and 4 deaths. In 2014, there was 1 case and 1 death. This slide here shows you the history, as in where the Uganda virus had come from, where it originated from. And you can tell at the top in 1967, when the German scientists had brought these monkeys from Uganda, this is where their exposure occurred. Most often it's in the sub-Saharan area because of the tropics. This disease, although it happened in 1967, is reemerging, as you've seen in the slide before, that in 2012 and 2014 there was several cases and then also fatalities. It occurs with human-to-human contact. It has the same viral genome they found out once they ran tests. The epidemiology is usually from human to human. It's an endemic, and the virus usually comes from monkeys and bats. There's an incubation period of about 2 to 21 days. And most often, your first symptoms are influenza-like. You'll get the headache, the chills, the malaise, the myalgia, all that. Then the next phase that you're going to go into is the early organ phase, and that's when your organs are starting to become affected. A lot of things that happen in this area is that you get shortness of breath, and there's abnormal vascular permeability. And the major hallmark to this disease is that you do have coagulation problems. In the late phase, which is usually anywhere from the 8th day to the 21st day, when you can have symptoms that are neurologic, symptoms that's affecting your body and pretty much taking you into a state where you're going to become affected, more so having convulsions, kidney problems, a lot of disturbances with your coagulopathy. So fatalities during this time is rather high. The World Health Organization describes it that anywhere between 24 to 88% of the time, most people will die from the Marburg disease virus. So the most important thing to know is that there's no vaccine. So the first thing we want to do is isolate the person. There's contact precautions. You want to quarantine these people. Make sure you're wearing protective equipment. That's gloves, gowns. You're washing your hands. And when you have these people that have this issue, you want to make sure that you help them by giving them a fluid and electrolyte balance, replenishing any lost blood and any clotting factors. And the most important thing here is, because the fatality rate, it can be high, you want to use safe burial strategies. And even still doing that, you do want to wear protective equipment as well. So the main thing is that you want to promote awareness, that people do know that, you have to wash your hands. You want to be careful when you're around animals, even eating these animals in these areas. That's, they're what they mostly do in Africa. So promoting awareness and making sure that we are isolating people that do come down with the Marburg virus. Thank you.